Okay, let's dive right into this explainer and discover the absolute marvel of engineering beating away right inside our own chests. We're talking, of course, about the human heart, but specifically, we're going to shine a spotlight on the unsung heroes that keep it functioning perfectly, day after day, year after year. You know, when we think of the heart, we usually just picture this big muscle rhythmically squeezing. But here's the thing. All that incredibly powerful squeezing, it would be completely, utterly useless if it weren't for a highly specialized internal system of control. So today, we're going to break down exactly how this control system works, and we're going to use some really simple, everyday analogies to make even the most complex medical mechanics super easy to grasp.
Think about this question for a second. Your heart actually beats around 100,000 times a day. Literally 100,000 times. Imagine trying to pump a thick liquid through a massive, complex network of pipes that many times, without a single drop flowing in the wrong direction. No way that happens by accident, right? It requires a flawless mechanism to guarantee that every single ounce of effort from that heart muscle translates into pure forward momentum.
To make this really simple to visualize, I want you to think of the human heart as a two-sided house. And inside this house, there are four distinct rooms. You've got two upper rooms called the atria and two lower, much more muscular rooms called the ventricles. Now, blood has to travel through these rooms in a very strict, highly coordinated order. There's no walking backward here. It enters an upper room, drops down into a lower room, and then it is powerfully pushed right out of the house. The entire architecture is built around one absolute non-negotiable rule: one-way traffic only.
So how does the house enforce this rule? Well, with these incredible one-way security doors that we call the heart valves. They are the true, undisputed guardians of your circulatory system. Just like a heavy security door in a building that's designed to only swing outward, these biological valves let blood pass through the second they're pushed from behind. But then, they immediately slam shut to prevent any of it from flowing backward. They're basically thin, incredibly strong little flaps of tissue standing guard between the rooms of the house.
Section 1. Heart guards. The four valves.
Because as it turns out, your heart's house doesn't just have one door. It relies on a highly coordinated team of four unique structures. These are the ultimate gatekeepers, making sure every single heartbeat pushes blood exactly where it needs to be. On the right side of the house, you have the tricuspid valve acting as the internal door between rooms, and the pulmonary valve serving as the exit door. Then, over on the left side, you've got the mitral valve, which is kind of unique because it only has two flaps instead of three, acting as that internal door, and the mighty aortic valve acting as the main heavy-duty exit out to the rest of the body. And this setup brilliantly divides the labor inside the house. The right side of your heart is essentially like a local transport system. It takes the oxygen-poor blood that's returning from your veins and just pumps it right next door to the lungs so it can pick up some fresh oxygen. The left side, though, that's the powerhouse. It takes that freshly oxygenated blood from the lungs and forcefully blasts it all the way to the very tips of your toes and the top of your brain.
These four valves perfectly ensure that the oxygen-rich blood and the oxygen-poor blood travel down their designated paths without ever mixing or reversing course. I mean, think about it. If blood were suddenly allowed to flow backward, this entire beautifully mapped-out circulatory highway would come to a complete disastrous standstill. The valves are the ultimate traffic cops, guaranteeing that the blue oxygen-poor routes and the red oxygen-rich routes remain perfectly isolated and constantly, endlessly moving forward.
Moving on to Section 2. How do heart doors work? Now, unlike the doors in your actual house, these valves don't have a handle. And even crazier, there is no signal from your brain telling them exactly when to open or shut. Imagine a door that swings perfectly open and then slams completely shut once every single second for your entire life, purely reacting to the pressure of the blood pushing against it. As a heart chamber fills up, the pressure inside rises, and that simply pushes the delicate flaps of the door open. The very millisecond the heart muscle relaxes, the pressure drops, and the back pressure of the blood instantly snaps the door firmly shut. It's a completely automatic, mechanically perfect system.
But for this system to remain flawless, a few specific things absolutely have to be true. The hinges must be incredibly smooth and flexible. The timing of the heart's pumping has to be perfectly synced up. And the lock on the door? It has to be incredibly tight. In fact, some of these valves are anchored in place by tiny, tough strings of tissue called chordae tendineae. Think of them exactly like parachute cords. When the heart squeezes with all its might, those little cords pull tight and make sure the doors don't blow backward into the previous room.
Which brings us to Section 3. When doors break down.
So, what actually happens when these vital security doors start to fail? Whether it's from aging, an infection, or just genetics, the plumbing of the house can begin to break down. Almost all complex valve diseases really just boil down to two simple mechanical problems: stiff hinges or broken locks.
Stenosis is when the valve becomes stiff, thick, and narrow. The door just won't open fully, which forces the heart to work overtime trying to shove blood through a tiny crack. On the flip side, we have regurgitation. That's when the valve doesn't close properly. The lock is broken, maybe those parachute cords got stretched out, and blood starts leaking backward into the very room it just left.
This quote really hits the nail on the head regarding why valve disease matters so much. A broken internal door translates directly into overwhelming, debilitating physical fatigue. Think about it. When your heart is literally wasting its energy pumping the exact same blood twice because of a leaky valve, or when it's exhausting itself trying to push blood through a stiff, rusty hinge, your entire body is being starved of the oxygen and energy it desperately needs just to function.
And if blood starts leaking backward or even just struggles to move forward, it causes massive traffic jams inside the body. This back pressure forces fluid right out of the blood vessels. That leads to visibly swollen legs and ankles, fluid actually building up inside the lungs, and really severe shortness of breath. It's fascinating, right? A microscopic internal plumbing problem with a tiny door creates these highly visible, life-altering external symptoms.
Section 4. Fixing the medical glitch.
Fortunately for us, medical science has developed some absolutely incredible ways to step in and fix these broken doors, saving countless lives and restoring energy to exhausted patients. Now, treatment almost always starts with easing the overall burden on the heart before ever jumping to complex mechanical repairs. If the problem is mild, a doctor might just suggest a low-salt diet to keep fluid buildup down. From there, it escalates to targeted medications to manage the plumbing, and finally to structural surgery if the door is completely compromised.
Now, you might be wondering, how can a pill fix a torn flap or a stiff hinge? Well, it can't. But medications are absolutely vital because they take immense pressure off the house itself. Diuretics essentially drain the flooded rooms in your body. Vasodilators actually widen the pipes so your struggling heart doesn't have to push quite as hard against the resistance. And beta blockers, they simply tell the heart to slow its rhythm down and just take a rest.
But when medications just aren't cutting it anymore, we have to turn to procedural fixes. One amazing technique is balloon valvulopathy. This is where doctors snake a tiny deflated balloon up a blood vessel, position it right inside a stiff stenotic door, and then inflate it to literally crack the door open. On the more intensive side, we have open heart surgery, where a surgeon meticulously goes in and repairs the delicate tissues, sews those little parachute cords back together, or just replaces the broken door entirely.
Ultimately, whether we're talking about managing the plumbing with daily medication, forcing a door open with a tiny balloon, or going all the way to a full surgical replacement, the goal is always exactly the same. Get the blood flowing in one perfect direction again. By restoring that one-way street, we stop the heart muscle from overworking itself, we prevent permanent, irreversible damage, and most importantly, we give the patient their active, energetic life back. So, I want to leave you with this final thought to consider about the amazing pump of life that is literally keeping you moving right now. Just while you've been watching this explainer, your 4 heart valves have opened and closed flawlessly thousands of times. They are the ultimate tireless guardians of your circulatory system. So between your diet, your exercise, and managing your blood pressure, ask yourself, what choices are you making today to protect your guardians?